Hello, and thank you for taking time to join me for this presentation on agricultural poisons. I'm Steven Yoder. I'm a registered nurse, and I work for UVA Health in the Blue Ridge Poison Center. As a nurse working for UVA Health in the Poison Center, I have specialty training and specialty certification in poisoning emergencies. Today, I would like to talk to you about agricultural poisons. To review my objectives, I want to discuss with you the toxic effects of two poisonous gases commonly found on a farm, namely nitrogen dioxide and hydrogen sulfide. My first dangerous agricultural gas I will be discussing with you today is nitrogen dioxide, also known as silofiller's gas. In contrast to nitrous oxide, commonly known as laughing gas and abused for its euphoric effects, nitrogen dioxide is highly toxic and is commonly found on farms shortly after filling a silo with newly chopped feed, hence the name silofiller's gas. This toxic nitrogen dioxide is heavier than air and will commonly be found trapped in the top of a silo immediately above the newly chopped silage. Nitrogen dioxide is a gas with a yellow-orange to reddish-brown haze and a bleach-like smell. Nitrogen dioxide forms nitric acid on contact with water. Thus, when inhaled in the lungs, the moisture of the lungs causes it to change to nitric acid, which is very irritating to the lungs. There is greater risk of nitrogen dioxide forming when there are weeds chopped in with the silage, or when corn is cut after a rain when there has been a drought. The nitrogen dioxide production is an ongoing process that starts only hours after the silo is filled and may continue for up to 3 weeks. As an example of how the toxic effects of nitrogen dioxide might unfold, I have here a picture of a large red barn with a silo immediately adjacent to it. The milk cows or maybe other livestock are kept on the ground floor of the barn. The nitrogen dioxide will form on top of the newly filled silage and then descend the unloading chute and dissipate into the area where the cows or maybe other livestock are confined, causing death to them. As mentioned earlier, the mechanism of toxicity is that nitrogen dioxide converts to nitric acid on contact with water. As the nitrogen dioxide is inhaled, it encounters water on the moist lung surfaces, changing the nitrogen dioxide to nitric acid, which causes severe lung irritation. The effects of inhaling nitrogen dioxide may vary in onset and severity, from immediate onset with coughing and choking feeling, progressing to wheezing and fine crackles in lung fields to a moderate dyspnea. More severe effects may be delayed from 2 to 24 hours and present as a flash pulmonary edema with an ARDS-like picture resulting in respiratory failure. Treatment is removal of the patient from the source of exposure, and in doing so, make sure that it is safe for you as a rescuer, and treatment is then largely supportive symptomatic management. The patient may require nebulizer treatments with beta-2 adrenergic agonists such as albuterol and supplemental oxygen. There also may be a role for steroids. Close observation is necessary to observe for flash pulmonary edema, which may present 2 to 24 hours post-exposure. This delayed flash pulmonary edema may be severe with an ARDS-like presentation requiring intubation and aggressive management. Most, however, will recover with supportive measures, but there are some who have lifelong chronic effects of this exposure, such as a chronic bronchitis or emphysema. The next agricultural poisonous gas that I would like to discuss with you today is hydrogen sulfide. It's also known as sewer gas or pit gas. Hydrogen sulfide is colorless gas that is heavier than air. It is highly flammable and has been known to cause flash fires. It is a byproduct of decaying organic material such as animal waste. Also may be found in other processes such as pulp-making factories, tanneries, petroleum refineries, and more. But for today, for the purpose of this presentation, we will focus only on the agricultural implications of this gas. It is found on farms and low-lying areas such as manure pits, hence it getting its nickname pit gas. Hydrogen sulfide is a chemical asphyxiant at the cellular level. It affects the mitochondria and cellular functions by blocking the body's ability to use oxygen in the cells, thus starving them of oxygen. Specifically, hydrogen sulfide inhibits the cytochrome oxidase, much like cyanide. Absorption is rapid and the effects are almost immediate after exposure. There may be a range of symptoms from mild to severe. Some lesser symptoms may be eye irritation, of noxious smell, nausea and vomiting, and cough. More serious symptoms include respiratory arrest, followed by cardiovascular collapse and death. Should there be a significant exposure and the patient escape with little apparent sequela, they should still be monitored for several hours, as hydrogen sulfide can cause delayed but rapid onset of pulmonary edema requiring mechanical ventilation. Considering how dangerous hydrogen sulfide is, can you smell it, and is your nose a good way to identify a safe or not safe environment? The answer is no, your nose is not a reliable indicator. At low levels of hydrogen sulfide of only 0.1 to 5 parts per million, there's a rotten egg-like smell, but a keen nose might detect such minute amounts of only 25,000th of a part per million. Interesting, OSHA will permit working conditions of up to 20 parts per million for 15 minutes, and that is 800 times greater than what a nose can detect. So a keen nose can truly detect very minute amounts. Medium levels of 50 to 100 parts per million can cause significant respiratory irritation, cough, difficulty breathing, and it's also irritating the eyes. And moving on, greater levels of more than 100 parts per million are considered immediately dangerous to life and health. What is alarming is that the higher levels, this sense of smell is almost immediately lost due to olfactory nerve paralysis. Levels of 3 to 500 parts per million may cause pulmonary edema, while levels of 6 to 800 parts per million are considered rapidly fatal. So if you can smell it, you're most likely safe at least for a short while. If you can't smell it, you don't know you're in a dangerous environment. Do not trust your nose as a guide if it's safe to enter a potentially dangerous environment. Here is a picture of an open sewage lagoon. You may also find a manure pit directly under a large animal confinement building. And the latter situation of a manure pit directly under a large animal confinement building is a much more dangerous scenario, as there's less airflow down there and increased potential for hydrogen sulfide to accumulate below there. Sadly, the most common agricultural exposure occurs in handling or in repairing of manure handling equipment, and the second most common being when a would-be rescuer becomes a victim trying to save their coworker. Again, the inability to smell gas is not a reliable indicator of safety. Ensure the scene is safe before entering a potentially dangerous area. Before treatment can begin, be sure that you as a rescuer or care provider are safe. As stated before, many hydrogen sulfide are rescuers who die in an attempt to save the victim. When it is safe to do so, the first treatment is removing the patient from the source of exposure and fresh air. Provide supportive care beginning with airway, breathing, circulation. Airway management, oxygen delivery are absolutely vital. Be alert for flash pulmonary edema, which may be delayed or immediate. The patient may need intubation, ventilation to maintain oxygenation. Treat hypotension with IV fluids and then vasopressors. Potential seizures, and seizures should be treated with benzodiazepines or barbiturates. There are some theoretical treatments including inducing methemoglobinemia with nitrates, which may promote conversion of sulfide ions to sulf-methemoglobinemia, which is less toxic. Unfortunately, there is limited evidence for this efficacy, and there is risk that the nitrates used to induce sulf-methemoglobinemia may create a worse hypotension and thus impaired oxygen delivery. Another theoretical treatment is hydroxycobalamin, which has been shown to improve survival rates in mice, but again, human data is lacking. In conclusion, agricultural gases can be fatal. Don't trust your nose on the farm, as the biggest dangers may be the ones you can't see or smell. Don't enter a silo for 3 weeks after it's been filled to allow any nitrogen dioxide or silo fillers gas to escape. You want to avoid low-lying areas where gases heavier than air may be trapped. The risk for hydrogen sulfide accumulation is worse on hot, humid days. Be conscious of the weather. Stirring or agitating a manure pit just prior to emptying it may increase the hydrogen sulfide release. And also, scene safety is absolutely essential. As one fireman told me, you didn't create this emergency and don't create another one by failing to verify your own safety. Finally, treatment for the two aforementioned agricultural gases is largely supportive. Remove your patient from the source of exposure, fresh air, and don't forget your ABCs. Thank you for joining me today.